If you are having a premature baby and you're aware that you are going to be having a premature baby, so the doctor's discussed with you that you're going in on this date for a Caesar, perhaps the reasons are they're worried about the placenta or the amniotic fluid, or maybe the baby's not growing well. If under those circumstances you have time to prepare, there are a few things that you can do which would really help you tremendously. The first thing is speak to the neonatologist or the nursery and find out how they feel about you expressing colostrum antenatally. The colostrum is known to be so beneficial, particularly for the Prem babies, in that they can absorb it and digest it really well, and they have less problems with their gut. When you're going in for the cesarean section, or if you're being induced, take that with you in a container where it's kept cold, so usually it would be frozen. You probably have to put 2 big ice blocks in and hand it over to the nursery so that the very first milk that your baby gets comes from you. And that would be just so beneficial, and you would feel that you've done something great for your newborn, because you really have if you give colostrum. Secondly, invest in a really good double electric pump. This is very important because without this pump, you won't be able to get that much needed life-changing breast milk to your baby. If your baby is very small, please chat to your doctor about the possibility of obtaining breast milk from a milk bank. Breast milk is life-saving for premature babies. If you cannot quite get enough in the first few days, that's absolutely normal. Any mil, even 2 mils or half a mil that you get is going to make a huge difference. If you can ask for a teaspoon from the staff on the ward and you express by hand onto that teaspoon, they can then take it to the ICU and give it to your baby. It is crucial that your baby's first milk is from you. It does make a difference and it does save lives. You can expect, if your baby's very small, that they might have quite a long time in the ICU. In that case, take your double pump with you to the hospital, or try and rent a hospital-grade double pump that is specifically geared towards premature babies, and start expressing 3 hourly in the day with a 4-hour break at night. So you're aiming for 7 to 8 expressions in 24 hours. This will help you to get your supply up so that when it does, when things do change and your baby's getting better, you can then bring your baby to the breast. And what determines successful breastfeeding is that the milk is there, that you've got enough milk to feed your baby and the flow is good, and then it would be much easier to transition. Ask the hospital, particularly the nursery, about speech therapists, occupational therapists for premature babies, so you can start with some sucking exercises. If the baby's very, very young, you may need to start doing that just to get their mouth working and moving, and just really to help prepare them for when it does become time to breastfeed. Usually we need to have the suck, pause, swallow. The breathing and the sucking has got to be in the right ratio. So we cannot have a baby at the breast if they're struggling to breathe and suck. If a baby's very tired and it exhausts them, it's also not ready. So the signs will be there, but guided by the ICU staff, that will be really when you can start breastfeeding. But what you can start doing very early on is asking if you could hold your baby skin to skin. This can be done from the very beginning, no matter how old your Prem baby is, and the research has shown that the benefits are massive, not just for the baby, but also for you to feel that you're doing something and that you're able to be close to your baby. It would help with the bonding later on. Ask the staff in the ICU if they could assist with that, and make sure that you've got people around you that are supportive of breastfeeding and help you with the expressing. Maybe put a reminder on your phone so that you know it's time to express, and put everything that you get into sterile containers. Also make sure your hands are well washed. So the important thing with premature babies is that they don't get infection. They're at very high risk for infection. So the protocol of going in and out the ICU will be quite strict. Probably just you and your partner will be allowed. Prepare yourself for a very long and emotional time. It is not easy to be separated. And if at any point you feel that you're struggling to cope, ask if you could speak to a counselor. And there is many things that can be done besides support groups, one-on-one counseling sessions. There are some medications that may be of assistance, and there are also certain medications that would assist with your milk supply to help increase it. So do chat to your doctor about that. A supplementary nursing system is a wonderful device that moms can use to feed their babies at the breast. It's really essentially a bottle that they wear around their neck with a thin tube that they would then tape with micropore just above the nipple. And when the baby's feeding, they're able to get the milk, whether it's formula, expressed milk or donor milk, at the breast. And the added advantage of this is not only do they learn how to feed and get that much needed sucking exercises, but they're also close to the mom, and the mom gets the benefit of having the baby breastfeeding, knowing that the baby's getting whatever they need to grow, and then of course stimulating their supply. As the baby's on the nipple and latched, the more the baby takes, the more milk you make. The more the baby stimulates, the better for your milk supply. So the ideal is always to get the baby to the breast, which is one of the reasons that many hospitals today are advocating for cup feeding. In the early days, sometimes a bit of syringe feeding, but that's not great for large amounts. So we prefer to stick to the cup feeding, and some premature babies can actually benefit from bottle feeding, from the stimulation, the sucking. And absolutely, this is a time where dummies can be used safely and where dummies are actually beneficial. The premature babies, most specialists are saying today that they could have a dummy from very early on. Another aspect with the SNS device is that you can see the amount that the premature baby is getting. And a lot of the times the moms are extremely concerned, and the medical staff, that the babies aren't getting enough. So this way we can put in the required amount and see that they get it, but at the breast.